that is along with my research partner, Dr. David Craig, and I. We are a part of a trilogy of researchers that are commissioned, funded by the Robert Wood Johnson Foundation to do a health equity study. We are specifically as a seventh cohort looking at racial and structural barriers that keep Black and brown people from proportionate health outcomes. We are Team Indiana. There are teams around the state looking at health equity, but here in Indiana, we have an opportunity to do interviews in 5 cities around the entire state. And this is Fort Wayne, and you are one of the 5 cities, and we're excited that we have this wonderful partnership with Health Visions Midwest. And we want to thank Sharon Tubbs, and we want to thank Angel Metro. We want to thank Peggy, who's over there standing at the door. Yes, and Kat, thank you so much. All right. Thank you all so much for your hospitality and for this friendship, as we are all working on the same team, trying to make sure we are identifying racial and structural barriers, and then figuring out what remediations can be, how we can, in real practical, pragmatic ways, ensure that laws change, that policies, procedures, regulations, and rules, they change. When we know things change, when we see documentation change. And so that's what we're looking to do with this study. And so we want to thank you for being here on today, and thank all of you all in Fort Wayne and this network for allowing us to spend a little bit of time with you on today. We want to hear from you. We do have a little bit of information, and our agenda for today, we would like to very quickly have some introductions, and we're going to turn that portion over to Angel Metro and Sister Sharon Tubbs, that they might greet you.
Hi, this is Gwendolyn Masterson. My number is area code 260-203-6400. I'm calling today to make a payment for registration for child passenger safety training for Marcy Baker, Marcibaker, Marcy Baker. My phone number again is area code 260-203-6400. Thank you.
We will just do some introductions around the room here, and then we'll go to Zoom. And if you just want to include your name and the organization you are with, if you wouldn't mind starting there.
Good morning, Pat Turner with Tobacco Free Allen County.
Gabriel Alma, with the Iglesia Príncipe de Paz.
Thank you for coming.
Diane Rogers, I'm with the Oxford Street Association.
Welcome.
Fiona Cox with Rhombus Incorporated and Oxford Association.
Laura Dwyer, Catholic Charities Fort Wayne, South Carolina.
Welcome.
Brenda Hoffman, Christian Community Healthcare.
Austin Rattler, Christian Community Healthcare.
Welcome.
Sheila Curry Campbell, Pilgrim Baptist Church.
Thank you, Sheila.
Melissa Wyatt, Appropriated Midwest.
Danielle Furge, Super Shop.
Thank you, Danielle.
I'm Carla Kilgore, YWCA Northeast Indiana.
Welcome, Carla. Thank you.
Sharon Tubbs, Health Visions. You beat that, have visions. And I start, I do.
Peggy Hayes, Health Visions.
Angel Metro, Health Visions. Okay, out there in Zoom land, can we do, yes. There's Meg.
Good morning, Meg Disler with St. Joe Community Health Foundation.
Good morning, Meg. Okay, let's see, Pamela, would you like to go next?
Sure. It's Pamela Cashdollar with Mental Health America, Northeast Indiana.
Welcome. Anne, would you like to go next?
Good morning, Ann Hall with Community Transportation Network.
Welcome. Tony, would you like to go next?
Good morning, Tony Gillespie, Indiana Minority Health Coalition, Vice President of Public Policy and Engagement, and getting dressed to go to the office.
Good morning. Joyce. Okay, maybe not. Felicia.
Hi, good morning. Felicia Stay with Aging and Home Services.
Good morning. Felicia used to be a team member here, so that's why she got a little extra love.
Yeah.
Ty,
Hi, Ty from Bright Point.
welcome. Melissa.
Melissa Martinez, Allen County Public Library.
Thank you for joining us, Melissa. Shelby.
She said her mic's not working.
Okay. Okay. Welcome, Shelby. Lori.
Hi there. Good morning. Laurie Weinzapfel from United Healthcare.
Thank you for joining us. Jared.
Good morning, Jared Blanchard with Purdue University Extension.
Welcome. Jan.
Good morning, Jan Moore from Parkview Community Nursing.
Welcome, Jan. Let's see. I'm not quite sure who's C. Reyes. Celia. Maybe. Okay, we'll come back. Celia? No. Cassandra?
Hi, Cassandra Rosine, Director of Business Development for Stillwater Hospice.
Hi, Angie Zagel, Neighborhood Health.
Hi, Angie. Hi,
Good morning.
Good
This
morning.
is Kathy Thornton with the Health Department.
Hi, Kathy.
Good morning.
Lisa?
Lisa Wells, Neighborhood Health.
Welcome, Lisa. Is there anyone else on Zoom that did not have a chance?
This is
Kelly.
Joyce Lothamer with United Healthcare.
Welcome, Joyce. And I think Kelly, maybe we met.
Kelly Bauman with Associated Churches. Thank you.
Welcome, Kelly. Okay, well, welcome, everyone. I'm glad you all had a chance to say hello. We wish you were here in person. And if there's nothing else, then we'll move forward with the presentation.
Wonderful. Thank you so much once again to Health Visions Midwest for this partnership that allows members of the Interdisciplinary Research Leaders Team Indiana. Once again, we are commissioned by the Robert Wood Johnson Foundation to look at health equity and specifically to look at Medicaid and the Healthy Indiana Plan, but we are seeking to look for racial and structural barriers that are hindering people in Black and brown communities specifically from proportionate health outcomes. And so our team consists of Elaine Hernandez. She is a sociologist with Indiana University. Dr. David Craig, Department of Religious Studies at IUI. And then I am Ivan Douglas Hicks, purveyor of Afrocentricity. I have an organization called the Africological Institute at Purdue. I'm also the pastor of First Baptist Church, North Indianapolis, where I will celebrate 25 years this coming Sunday. We have come together. Interdisciplinary means that we come from different backgrounds and have different approaches, and it is that multifaceted approach that we believe will provide us an opportunity to have different eyes from a different perspective, looking at similar problems to come up with solutions. As we said before, we're looking for remediations. We're looking for ways to change policy and law and procedures and rules and regulations so that we can document change that has taken place so that people that are disenfranchised and don't have positive health outcomes right now, we can say that and memorialize our work to say that this is what we've been doing in order to ensure a healthier community. And so our research team, there are those that are with us, Laura Henderson and Dr. Gwen Kelly. They've come up on today from my organization, the Africological Institute, then from IU Bloomington, Desiree Jackson, Desiree Jackson and Delaney Marks. They are with us as well. And we have not just a talented team of people that are looking at quantitative and qualitative ways, so that we have a team of folk that are numbers crunchers, and we have the opportunity to look at Medicaid data with a talented team of quantitative researchers. And so from looking at numbers that we receive to the interviews that are taking place all over the state, to our community leadership board. Community Leadership Board is in 5 cities, including Fort Wayne. Pastor Bill McGill is our lead here, along with Sister Sharon Tubbs and Angel Metro. They make up our tight team here that have been working in this area, but also Gary, East Chicago, South Bend, Indianapolis, and Bloomington. 4 major urban centers. Bloomington, it's where our research team, a number of us are there, and so it's sort of like a fishbowl. It's a different thing happening down in Bloomington than the other major centers, but it still allows for us comparison and contrast, which is what we're seeking to do with all of these states and cities. So we'll have similar experiences like this in the other 4 cities. We'll be able to compare not just the data that we get back, and we want you to give us as much data as you can and input, because we're valuing you as the experts in this thing, and we need what you provide for us to help us to make determinations as to how we can ask for and in many ways push for changes to take place. So there's a community leadership board that is all around the state. First of all, Gary in East Chicago, Pastor George Washington Carver Walker Jr. at St. Mark AME Zion Church, along with Tracy Lewis, who's the Chief Executive Officer at Community Advocates of Northern Indiana. In South Bend, we've partnered with the President of our state convention, President Andre McGee. And in Fort Wayne, certainly we've mentioned the partnership with Imani Temple Baptist and Pastor McGill and Health Visions. And in Indianapolis, the Crossroads AME Church, Pastor Jerry Davis, along with Robin Nichols, Health Commission Chair. And then in Bloomington, we have partnership with Hoosier Action, and we also have partnership with Centro Comunal Latino. These are community experts that are within that health equity area, that sandbox, but we are looking to not just gather people that already know and that already have this expertise. But it is our hope that as we progress, that we will find others that are in other sandboxes and other arenas and other spheres around the community, that we can provide some information, but then once again, get input from people around the entire Fort Wayne area that can give us some input that lets us know these are some unique problems. These are things that Fort Wayne has done to deal with these common problems that everybody has. But our listening ears, we're seeking to find out what the Fort Wayne solutions have been, and how what you all have done here to ensure that those that are historically marginalized or disenfranchised receive proportionate health care outcomes. You guys have done something brilliant and genius here in Fort Wayne, Indiana. The rest of the state and really the rest of the world will probably be better if we have an opportunity to hear more of what you're doing here in this area. So that's our task on today. We've been listening a little bit, and we've been around the state doing these interviews. We'll continue to do interviews, but at the same time, we are looking to actively create a network, so that in 2019, Dr. Craig and I produced a study, Health Equity in Urban Congregations. We published that in 2019, and we were able to make 11 recommendations to the FSSA and to state legislatures for specific things to take place around communication and the reduction of bureaucratic hazing that takes place, that keeps some people from the same level of health care and health outcomes. So we were able to make those recommendations. Tony Gillespie is here from the Indiana Minority Health Coalition. We're appreciative for them commissioning us and supporting us as we did that work. And so following up on that work, now in the midst of the pandemic, we were able to receive this commission from the Robert Wood Johnson Foundation. And now we're looking at health equity as we have come through. And the public health emergency has been deemed to be over, and there's redetermination and new regulations and old that are kicking back in. And we now have a vulnerable population that continues to need the work that everybody in this room and on this Zoom is doing exponentially, so that people that are hurting are not more hurt by what we're facing right now. We'll talk about that a little bit later on, but you are the community experts, and we're gathering community experts from all over the state in these 5 cities. We need that input from you, and so thank you for your sacrifice of time on today as you come. There's a survey that we would love for you to fill out that allows us to know not just how we should proceed and what we need to know about Fort Wayne, Indiana, but we want you to feel free to volunteer every individual and organization you can come up with, give us their emails and all of that, right? So that we can, once again, in 2019, we were able to make recommendations. With this commission from the Robert Wood Johnson Foundation, this is action-oriented research. We are, as a team, purveying a term called community valued research, where we value the community as the expert. And so we need input to come from you, but we also need to make sure that we're getting these emails. And in Fort Wayne, we have a robust crew of people that have heard what we're talking about and heard of us, but they're not just going to be recommendations at the end. For us, there are going to be recommendations that come with a network of people that we've cared to take trips and form through relationships all around the state, so that when we make a recommendation for the law to change, we also have a coalition of people, a network of people from different backgrounds and different zip codes and different experiences, that when that proverbial email goes in or that old school letter goes in, it's not representing one demographic, it's not representing one zip code, but we'll be able to say that there's some people that are concerned because we do not have proportionate health outcomes for all people within the state of Indiana, and we are all banding together to say that there's some things that are wrong that can be fixed. And we demand it. Somebody say we demand it.
We demand it.
That's what's up, Sister Rogers. That's what I'm talking about. All right, so please fill out that survey so that we can be back in touch with you. There'll be a follow-up experience that we'll let you know a little bit about a little bit later on, so that we can grow more. But I'm going to turn it over. We have some preliminary information, and we want to talk so that you know a little bit more about us. Past that survey in slide 12, but we want to look at HIP enrollment changes in the initial study findings. I'm going to turn it over to Dr. David Craig.
Thank you all for being here. Thank you, Dr. Hicks. So I'm going to talk a bit about some of what we've learned in the study so far, but this is really meant to be just preliminary to a conversation. So these are initial findings. We're still working away. So if you can move that forward. Our study is asking this question. We're studying whether and how changing Indiana
Dominic, gentle.
during the public health emergency affected health inequities, both in terms of who's enrolled in Medicaid, but also who uses Medicaid. So we're trying to understand, when the rules changed, did some people do better than they had done previously? Because obstacles were removed and certain administrative burdens, as they're called, were suspended. But what we're particularly interested in is this question, is do the hurdles that people have to go through to get Medicaid affect different communities differently? That's really the question. Are the burdens racialized, to put it another way? So we've got 2 hurdles here. Everybody's crossing hurdles. But is it possible that some hurdles are higher for some groups of people? And so if you look at this, this table here on the corner, this was 2018. And there are 2 tiers in the Healthy Indiana Plan, which is the Indiana Medicaid expansion. And African Americans were about 50-50 on plus, which is good, and basic, which is not so good. Now compare that to the white population. Many more white people are on the plus than on the basic. What's going on here? This is the question, right? Are the hurdles different for people who are situated differently? Okay, so that's kind of the question we're trying to understand here. So why does this matter? Well, it matters because plus gives you vision, dental, and chiropractic services, and no copayments. When you go to the doctor, when you go to the pharmacy, you don't have to make a copayment, right? You do have to make a monthly contribution. These are the old rules to keep your HIP plus, and a lot of people found it very hard to make this monthly contribution. So they went to HIP basic. They lose their vision, they lose their dental, they lose their chiropractic, and every time you go to the doctor, every time you get a medication, there's a copayment. We know copayments inhibit people's care. Okay, so this is the old rules. Okay, this is the old rules. Now then, what happened? So COVID happened, and the rules changed. And if you can click that one more time. Whoops, one more time there. Keep going. So what happens? We get continuous coverage because people are no longer having to prove their eligibility year after year after year. Monthly premiums go away and co-payments go away. The rules are radically different starting in April 2020. All right? And then what happens next is some people were on HIP basic when the pandemic hit. They stayed on HIP basic. All the new people went on HIP plus. But the old people who were on HIP basic stayed on HIP basic. And advocates raised a ruckus and said, that's wrong. So finally in July 2021, more than a year later, people were bumped up to plus from basic. Okay. Next thing that happens is this is going along. Well, redetermination returns in March of last year, well, April of last year, and people have to start renewing their benefits again. And now comes the next shoe to drop. The cost sharing's coming back in July. July 1st, it's all going back to the old rules. People are going to need to make monthly premium payments to keep their HIP plus, or they're going to have to make co-payments on HIP basic. Okay, so let's look at what happened in terms of enrollment trends. Look at this, 400,000 plus people on HIP at the start of the pandemic. Rules change. It goes up to 800,000 plus people. The program almost doubles in size. Now, over the past year, we've had redetermination. 100,000 people don't have HIP coverage right now. Some of those people's incomes were too high, but were able to stay on it during the rule suspensions. But other people are falling through the cracks. But look at how high the number is, 700,000 above that 400,000. Sound the alarm. The Medicaid unwind can do harm. The question is, are we going to fall from that 700,000 number down closer to that 400,000 number where we were when cost sharing was in place? Because people don't know it's coming back. And it's coming. It's coming in just over 2 months.
And the taxes went up too, on everything,
So this is why we are here. This is why we are here today. Okay, so let's dive a little bit into some of the data here, just to try to understand some of the things that we're learning so far. So how do enrollment patterns differ across different racial and ethnic groups? This is one of the things we're trying to understand with some of the data analysis that's been done. These are early snapshots. Just to be clear, we're still kind of making sure our data analysis is accurate with FSSA, the Indiana Family and Social Services Administration. We think this data begins to raise important questions, and we want to share some of this with you. So here's a chart that shows African American enrollment trends. And plus, again, is the green that gives you more benefits. And then the kind of orange color is the basic, which gives you less benefits. So if you click this one more time, you're going to see that African Americans on plus versus basic are pretty close to each other, about 50-50%, and that was the case before the pandemic hit. But then look at the bump up from basic to plus when FSSA moved people from basic to plus. African Americans benefited significantly in getting more generous benefit packages when that administrative rule happened in July 2021. And you can see there's significant growth in plus benefits for African Americans, right? So what are the takeaways from this if we click forward to the next slide? So one of the really important takeaways so far is that Black enrollees had the largest proportionate increase in gaining more comprehensive HIP plus benefits. That's because there was a significant low level of Black enrollees on HIP plus before the pandemic hit. So there's a big bump up that happens not only when the rules change, but when, in some sense, the problems with the old rules were corrected. Okay? Moving forward. Black enrollees also had the largest proportionate growth across all plus plans during the public health emergency. And one of the questions is, what happens when the rules come back?
And then what happens when the rules come back, then they just drop everything. They just give up. They don't go to their appointments. They don't do anything. It's the domino effect of a whole nother waterfall of trauma coming on them because they can't get the resources that they need. So then a lot of things, it affects with the mental, it affects with everything, it affects with them caring for themselves, their property, and everything else.
Cascading issues, absolutely. So continuing. So these are some findings for Hispanic Latino enrollees, and we're still trying to make sure that we're doing this analysis right. So I'm putting this in, I'm using a peer's language because it's very significant. It appears that Hispanic Latino enrollees were the most likely to have the less comprehensive HIP basic benefits before the pandemic. This is contrary to what state data says. State data says that actually Hispanic Latino enrollees track pretty closely to white enrollees. But the analysis we've got says that is not the case. That in fact, the group that is most likely to be on HIP basic are Hispanic Latino enrollees. Again, we're still trying to make sure this data analysis is correct, but that is a major finding that's coming out of the analysis so far. And then continuing, total Hispanic Latino HIP enrollment was pretty level even during the pandemic. You didn't see that dramatic growth that you see with some other groups. This raises all kinds of questions, right? Why is that the case? And so this is some of what we're hoping to discuss with you all to make some sense of it. Okay, so if we move from the quantitative data into some of our qualitative findings, and I just want to indicate that these interviews were done by us, not by FSSA. This is something we have to make clear that they didn't collect this data. This is our data collection, just to be perfectly clear about that. So one of the things that we have this 2019 study when the rules were in place, and a lot of what Ms. Rogers just said are things that we found out at that time. So why is it hard for people to stay on HIP during the old rules? Notices the communications is the big one. Communications. Things are sent by mail. Now that's a little bit more not the case now. People can opt for different communication channels, but the mail problem is an issue. But there's so many breakdowns between FSSA and the Division of Family Resources and managed care organizations and the call center. That's a big issue. But the other one is that HIP is complicated. There are many plans and there are many steps to get, keep, and use HIP.
And it's by design. Thank you very much. It's by design. So until you fix the design, you're going to keep having a problem. You want a solution? If you set it up to be this kind of, you're going to get the same kind of results that you keep getting, and they're constantly making changes. People can't keep up with this. And that is what they're planning on, this by design. Keep going.
No, I hear you. So, okay, so continue. Right, so this is a term that came up with bureaucratic hazing, to pick up on this term, is like, okay, why is this happening? Well, people feel lost and unsupported. It's very easy. You have to keep jumping through the hurdles, and they keep coming, they keep coming, they keep coming, right? Okay, so talking to some folks during our study, so this is, so this came also out of that. These are the things you mentioned.
Yes, I deal with every day, yes.
This is what are the things that make it hard to stay healthy in your community? Number one, transportation, food desert, mental health, stress, stigma, mistrust. And when the hurdles keep coming at you, you've run this race before, You know I was gonna go. It's very hard to stay in the race, right? It's very hard to keep jumping those hurdles. So a couple of people we've talked to, one of the questions is, well, did suspending the rules make a difference? It made a huge difference to people.
Who are you talking to when you say the people? Who?
Great. So we have done interviews with people who are enrolled on HIP in 5 cities across the state.
Here in Fort Wayne?
Here in Fort Wayne. We did.
Where did you get those folks from? How did you get them?
So we got these folks, FSSA provided us their data set, and we selected an equal number of Black, Latino, and white enrollees based on a random sampling and reached out to people with 600 postcards and scheduled people for interviews, which we conducted at Imani Baptist Temple here in Fort Wayne. Do you have another question?
I have a lot of questions,
Okay.
but I'll stop.
Okay, right, yep.
I mean, because a lot of this, I mean, I'm gonna stop. Pat gave me that look, so I'm gonna stop.
No. I mean, she could just stop and open it up now. Okay.
When you say Black population, does that include all populations of color, or, because I come from
Right.
Refugee and Immigration
Yep.
Services, and we have all populations, so I didn't know.
African American, so non-Hispanic Black is the category, non-Hispanic white. There's also a big broad group of Asian. We have to work from the data from the numbers in the FSSA data, which only break it down into
Those two, okay.
non-Hispanic white, non-Hispanic Black, Hispanic Latino, Asian, other races, and not known. Those are the categories we get from FSSA. Yep, okay. So, I'll just sort of quickly give a couple examples and then really open it up here. So here's one person we interviewed. Does it make a difference to pause the rules? Yeah, so he says, with HIP, I didn't have to go through that, some of the issues that he'd had previously, right? In fact, I would always order my refills online. At the end of ordering it, the amount due, 0. That's a joy. That's a headache that you don't have to have. This is sort of relieving that stress. While I had that $2, having that $1 a month to send in to keep your HIP Plus benefits could be a struggle. July 1st, 2024. Like I said, when it was waived, I was so happy. Another example, what has happened when the rules start coming back, when people have to begin to prove their eligibility again? Here's an example of a Latina woman. I should say these are not people's real names. These are a 40-year-old Latina woman who got benefits during the pandemic, but then she got a job, so her salary went up, and when she had to renew her eligibility, she was no longer eligible, and she didn't know how to navigate things at that point, so she's still without coverage, and she's delaying care. And this is what she said. We are here in the United States. I think that the second language is Spanish. We have a lot of Latinos over here. I think that's a good idea, hiring or training more people who speak Spanish, but sometimes if you cannot speak English, you know how to explain nothing. It's hard. Okay. So these are some of the findings that we have so far, and I'm going to pause.
All right, so the process has been that we have reached out and had interviews in 5 cities so far. Now, after we're looking at these interviews that we've done, in each city we sent out postcards that went out to 600 people in each city that allowed them an opportunity to self-elect to respond to those cards. When they responded to those cards, then we were able to set up interviews with them. We are coming back into each city now after conducting about 80 interviews. We're coming back to each city because there's what we have identified as some gaps that we need to fill in order for us to be at sample so that we can feel good about the data that we've received. And so we need to have more interviews, we know, with Latin men, with African American men, because they are undersampled in what we have so far. And so we're coming back to do a phase 2 of interviews in each city. As well, we're having these community expert conversations. And so when we say community expert, turn to your neighbor on your left and on your right and let them know you are the expert, and you have been assembled today that we might hear, because we are. I guess I've been saying 11% of the way finished for a while now, but we're really early on with what we're looking at and what we're able to discover. But a part of our discovery is to ensure, once again, in a community valued way, that we are engaging experts within the community. And when I say experts, I am, yes, talking about those that operate within a health equity environment, but I am more so talking about people that perhaps do not operate but have opinions and have guidance and direction, that don't do this every day, but are nevertheless people that we need to hear from. And not only do we need to hear from you, but part of what we need to hear is how we can reach out beyond the normal, usual suspects that do this work, to form a coalition, to form a network. So once again, that influence that we are providing in order to get laws changed or policies and procedures changed, that does not simply come from people that have the badge already, but they're people that are mayors of communities that don't have titles, and they're people that are working every day in this area and doing real stuff, and you are the expert, right? And so that's what we're seeking to gain right now. We have a little bit of information we can give, and we'd love to talk about that initially, but really, as we're talking about this information we have, what we need to hear from you is a response to our questions for our study, right? Which is that there are racial and structural barriers that are keeping people from proportionate health outcomes.
I mean, that's pretty obvious. I mean, you know.
Even on international level, Fort Wayne already made this quote, so it's not, the study's already been done.
Yeah, the study's done.
Right, and then as well, so we need to hear that, and we also need to hear what remediations, what solutions are coming up. What are you all doing here in Fort Wayne, so that we are privy to the local knowledge that you have, and so we're looking for guidance and direction in those two areas that help us with these two overwhelming questions of our study. Yeah. So are there questions about, first of all, we've given a lot of information about our HIP study and who we are, but we've given it very quickly. Are there any questions about the HIP study that we're doing, or even some of the early information that we're coming up with now?
For the participants that have to use the HIP service, are they putting things in place to help the people get the service? Are they working on being because one of the things I come to find out, a lot of people can give you a lot of information, but no one can show you and guide you what it is that you need to do. And that is the biggest problem. Everybody is being informants on what you need to do. No one is showing. I thought this was one way to build a community up was that you told them, you showed them again, but we don't do that. We tell people we drop the ball, and then when they don't get it, then we want to tell them, well, you didn't do this right. Well, what are you getting paid to do? If you know the proper form of the protocol of what needs to be filled out, what are you getting paid to do just to tell me to fill it out? And this is the biggest problem. And when you have the people that's in the front line is trying to help the people and you're trying to guide them to the agency where they need to go, then the door is shut in their face. So then that is why we get nowhere. So are they repairing that problem?
Right. And so
are they repairing that problem?
In 2019, that was very much a part of the recommendations that we provided to firm up communication in this bureaucratic hazing and to deal with that. And so right now there are navigators that are technically in position to provide for MCEs and for Anthem and for the HIP program. There are people that are paid to provide navigation for people that, if you can get to them and it's a good day, then they'll help you. But that's a part of what we're seeking to do. Do you all remember how the Bureau of Motor Vehicles used to be about 10 years ago? It was terrible. You'd be there all day 10 years ago. But somebody made a decision to say that we have to fix the system.
And the way we fixed the system, I don't know what it was, but all of a sudden, as opposed to coming in and staying there forever, people would stand up when you walk in, and they would make sure that you got through there quickly because somebody changed the system. And so as opposed to people that are navigators pretending like mall cops and they have their flashlight and that's their authority, as opposed to having navigators that are protecting and feel like they don't want to register, what would happen if we would incentivize and push people that are employed and train them to help people get through the system as opposed? Wouldn't that be nice?
That would be the number one solution to the problem.
Exactly.
I mean, if everybody has all these degrees and intelligence, I mean, that is the most wise thing to do.
Yeah, you know, they're always saying this call could be monitored. Do you guys really monitor? I mean, was that part of your study? Did you do any monitoring of the services that are being provided? Was that part of your Robert Wood study? Was that?
No, that's not, that can be, and once again, we're going through a process right now of discovery, right? And so it is now a part of it because we have this meeting on today. And certainly, as we've said, the pre-notion is there because we've talked about the Bureau of Motor Vehicles as an example, but that's where we are right now. We are going to discover in 5 different cities a lot of the same problems, right?
These coalitions.
Excuse me, hold on, Sheila. Dr. Hicks, let me speed this along because I don't want y'all to run out of time.
Yeah, right.
Yeah, and you've got some questions that you want to ask. And I want to ask Cassius, are there any questions that have been posed online?
There hasn't been questions online. Christine Howe just mentioned, she said she wanted to tell everybody that the FSA and insurance code is conflicting and have been transferred. She's been transferred between 2 with 0 resolutions, and she's willing to work with those to be part of the conversation.
Okay, awesome. Now, let's get to the questions that you wanted to pose.
So cool.
There are not many other
I just wanted to.
Oh, Laura had a question. Let's let somebody ask you that.
Transportation was your number one barrier, so those navigators need to go to the churches, and they need to go right into the neighborhoods. Does that not help? No.
Okay.
There's another question online as well.
Okay, Lupita, you had something?
Mine is not a question, but for example, one of the services that television started providing for the Hispanic community is help them to get insurance. And I need to have a navigator to make the application with the client. I tell the client ahead all the documents that I need them to bring. The day of the appointment, they don't bring all the documents. Some of the clients don't even have transportation, so then they are in their home, and I'm using the television phone, and I have the navigator for my cell phone. And after we complete the application, I have to go to their home to make copies of the documents they need. Sometimes they already missed documents, lost them, and sometimes they have employers that they don't have the pay stubs, or they don't pay them with pay stubs. I need to go back to my office, make a letter for the employer to sign, asking them how much they make per hour, how much they make per month, how much they make each week, go back to my client's house, give it to my client. And even sometimes like that, the employer don't want to sign the document. So I need to go to see the employer, explain to the employer what it's for, who I am, and then they sign the document. But really, if I were not doing all that, these people would not get the insurance. And it's not only with Hispanic, even if I help someone else, where in that household there's just one car, husband taken to work, mom is there with no transportation, overwhelmed, and even if it's in her language, the form, feel scared to fill it herself. And I need to help. So it's really hard because basically these people, when have a navigator sometimes is not enough because there's the other piece of getting the documents together when the navigator is by phone and someone driving to their home, even making the copies they need. And if I don't do it like that, it will not be done.
So you are getting some of the feedback that you were
Right. So
talking about. Yeah.
So that all of this has been the answer sort of to that first question of our study, which is what are the structural and racial barriers that are hindering people from getting the health outcomes?
They're not at the table as part of the coalition. I think it needs to be the actual people that are receiving the service. You're talking to us, you know, and this is one of the problems we have in the Black and brown community. We have people dictating to us what we need versus asking those individuals, what do you need? Thank you.
Yes, ma'am.
So Sheila, we are partners with them in reaching out to people in the community. So in fact, their research has been with people in the community. We as a coalition are people who work with the underserved. So they're getting input from us, okay? And we don't know if there are some people who are also on HIP in this coalition. There very well may be. So they're getting input from us, they're building bridges, and they're collecting emails so that they can go forward and get the research that they need and make the analyses that they need. So this is not a problematic forum here. This is a first step in this community in terms of engagement. Okay. Were there any questions online? I'm sorry.
Question online.
What are some of the questions, Cassius?
How's the new Pathways program going to complicate all this?
Amen.
The other question was, how can any of the issues be resolved so folks don't lose insurance by July 1st?
And that's part of the question that we're asking.
So wait a minute, what was the first question?
How is the new Pathways program going to complicate all this?
Do we know what that is?
How do you think that's gonna happen?
We have a lot of folks that's been looking at this pathway. Folks have called me about it. I told them I don't know a lot about it. They think that it's going to be an opportunity for them to get income for helping their parents that are sick, shut in, take them to different appointments, but nobody knows how it works. And so I don't know if this was, it had to be on the table while you were doing this study because it's coming out here in July. So what role did caregivers, were they part of your conversation? Or
Yeah, I mean, not specifically that we asked for caregivers to be part of the interviews. We just sort of widely invited people to participate. That actually is not something that has come up yet in our interviews, but that's probably the case that it hasn't hit yet, and so people aren't really aware of what it means and kind of the difficulties of navigating this additional program.
What was that second question, Cassius?
How can any of the issues be resolved so folks don't lose insurance by July 1st?
Well, first of all, early on, maybe about 18 months ago, there was no buzz, but it was discovered, and members of our team and a wider coalition began to have conversations with MCEs, with insurance companies, and with FSSA. We cannot pat ourselves on the back, but we did early on push them so that there was a portal created for redetermination. We were sensitized to it because we've been working on it, but at a particular point before April, beginning of last year, there was a lot of advertising that took place to let people know that redetermination was coming down the pike. That same type of pressure and that same type of awareness and education, that's why you come to Health Equity, a coalition in Fort Wayne, and we say, hey, you know, how can we continue to get the word out about July 1st and this cost sharing, which I have tagged as a poverty tax, right?
Ghetto tax.
Yeah.
That's what we call it.
It's a ghetto tax?
Ghetto tax.
All right, well, I might change my little flyer, right?
It's probably a good terminology.
Yeah, but you're already behind and in a bad situation. And as one of the slides said, that we have to send in $1. So I have to spend 60 cents on a stamp to send in $1, right, in order to have this cost sharing take place. It is prohibitive. And it is yet another way to try to keep people off of the roles and outside of the health care that they need. And so, you know, we need to make everybody aware, and we need to make sure that we are reaching out through our constituencies and through our networks to let people know that this is coming down the pike. At the same time, how can we, put pressure on FSSA to make sure that they spend another $1 million, or the legislature to spend some of that super majority surplus they have over there, in order to let people know that there's danger. And so that's really, sort of where we are and what we're seeking to do.
Another thing too that I see, and it's just the way that society is going about things, and I don't like it, in terms of why are the consumers doing the job? Why are the consumers doing the work?
Yeah.
In what context are you
in terms of, they might not understand the jargon of everything that's being asked. We go to the grocery store, we have to scan our groceries. There's not anybody in there to help us. So I think that maybe if we can have I don't know, at the library or something like that, a center set up as to where they can come and get the help and get the services and get set up.
They make sure they get the cell phones and the free phones and the free tablets. They make sure they get all of that. They get all their personal information for that.
Yeah.
They make sure they get that. They sit there all day. Some people, they do all kind of manipulating things. They make sure they get that. They get all the information for that.
So I think you got that point taken. Pat had a question.
So my question was kind of goes hand in hand with yours, is that why can't you create more navigators? Period.
Face to face.
Yeah, just create more navigators.
Everyone doesn't have email or know how to access email or go on
Have
the
them at
internet.
the churches, or have them at the library, or have them wherever. Why can't we create more navigators to assist people? I'm a pretty educated person, and I was on HIP at one time. It's complicated.
And those questions, you don't understand. Because when you check yes, you are agreeing to something that is not what you meant to agree to.
So let's create more
So it
navigators.
creates that confusion.
We can actually use our community health workers to do this.
Health vision.
I'm just saying,
We're
Sharon,
navigators.
we are navigators. We are all advocates, and I heard you talk a little bit about advocacy. I know the NAACP was very involved when Medicaid and all of those changes happened last year. Are you working with any national organizations here in the state of Indiana to push this agenda? I mean, I'm just asking. Were they part of this study?
Yeah, they're friends, right? We had, as a part of dealing with the social determinants of health, a few CEO conversations in Indianapolis, Indiana, that brought all the hospitals together. And as a part of our study, we are examining those conversations at the NAACP and Gary Holland, but also our state education chair of education is Dr. Gwen Kelly, who's with us on today as part of the Africological Institute. And so we are connected.
You're the state chair for the NAACP?
For education, NAACP education.
For the education committee.
Ms. Sadie was just here yesterday.
So yes.
We have a quarterly meeting on Saturday, and I'm gonna bring up some of the things you're talking about also.
Most definitely.
Right. Right. So we are in a position now to get this input and to determine that yes, there's some communication, because if we come up with 50 more navigators, if the government does not create an advertising campaign that lets people know that this is how and where you get to the navigators, then navigators will be paid. And if they're not trained to want to get people through the system, then they'll be like those mall cops we talked about before. We'll just have more of them, right? And so communication, and also there's a principle called sawubona. I see you, I hear you, right? Not just with my ears and eyes, but with my spirit. And so when it comes to Latin, not only is it this communication in terms of how we communicate outward, but there's a language barrier a lot of times, and there's no attempt to fight through the language barrier, and it's just another prohibitive thing that keeps people from the health outcomes within our community. And so that's what we're listening for. So language barriers, communication,
Even
what are
your
some other?
breakdown, the races, I mean, Indiana has a large population of Burmese, and that population has been in this space over 10 years.
Yes.
And so a lot of those folks are gonna qualify for these opportunities. And so when we're talking about races, and I went through this with suicide, how they put all, you know, you either black or white, and that's not true. So we need to be more intentional about breaking down the races in categories, and then being intentional in tending to these folks. I mean, there's several dialects in the Burmese community, and so, like I say, I know we're trying to get the community health workers out there, and I know Ms. Peggy just told me about another program in August, so I think that could fill that gap. Thank you.
Alyssa?
So from my personal experience, I've had hip, and I've had to drive to South Bend because they didn't have a retina specialist in Fort Wayne that took my plan. How is it possible that in the city, I have to drive 2 hours away? What if you can't do that? What if you don't have the gas money? What if you don't have the car? What if you don't have someone to drive you? They told me, you need a driver. This is Thursday, we want you to go tomorrow, but Monday, can you go Monday? Find someone else to take off work too. That could drive, so a lot of people may have elderly people that can take them maybe because they can assist there, but they can't necessarily drive the whole trip. And that is where I have to go for every follow-up, whether that's a 2-week follow-up. Come back again. One day, there and back. We'll see you again in a month. We'll see you again in 3 months. We know how specialists are. That's fine. When we're talking about your vision, you only get one set of eyes. This is important. But is this always something that's accessible for everyone? When you're telling me to go somewhere else and it was a slap in the face, because I have insurance, and you're telling me, well, no one in the city takes your plan. How is that even possible? For no doctor, no specialist, they take hip, but not that plan. Oh.
So this is a raucous conversation we got going on here. We need to, and I'm gonna get the feedback in just a second. Were there any other questions how many questions do we have online?
No, they've been answering themselves. They
Okay. We have to get you the dialogue from online as well. Yes. So, yes, it is being recorded, and I know that you had some questions. I saw you shut your laptop down. I think we had enough input and feedback, so we're gonna take a couple more comments or questions, and then we're probably gonna shut it down. Is that okay for that?
And I tell you what, there is even as we prepare for these last couple of questions, there's a QR code. There's a QR code on your desk. There's a big one. That big QR code is for our next follow-up, which will be on May 8th. There'll be a Zoom conversation. There's limited space. And so please hit the QR code. We want to have that follow-up. Our hope is that there's been communication that has gone out that has asked you as health equity, a part of this coalition, to identify for us people that are HIP and HIP eligible. As we said before, we're looking for African American and Latin men so that we can do another round of interviews with them. There's information about our study on the smaller QR code. There's also on this bigger one an opportunity to register for this Zoom event that we will have, and so we want you to please give this information, and it's important for us. And once again, while we are learning and while we're doing these interviews, we're coming up with ways in which to make recommendations for laws, policies, procedures, regulations, and rules to change. As we're doing that, it's important. We did it in 2019, but what we discovered is that if we make these recommendations, they're just recommendations if we don't have a coalition behind us. So
do you have a lobbyist?
we have lots of friends. We do not have a lobbyist. And it's an academic study. It's an academic study, right? But it's an action-oriented study. And
what bills are you following right now, or what? I mean, folks is done now, but is there any bills that we need to be rallying around? I mean, what are you looking at now?
There are not specific bills right now that are pushing for changes. The big concern is that the state discovered a $1 billion shortfall in the Medicaid budget. And there's a lot of pressure right now to cut back on Medicaid benefits. So
Are you guys really that surplus?
Okay, so.
well,
hold on a
believe,
second.
I would certainly
They
want
still
to.
won't go, they still won't go to the
Dr.
surplus.
Hicks, did you have some
There's
closing?
one other
so
thing
we
that
can
I
get
want to
these
draw.
two people?
You haven't mentioned anything about the evaluation or something.
Yes, so there's also an evaluation and survey on QR code, the smaller QR code as well. Please make sure you fill that out, and this is our segment and space to do that. The survey, the evaluation, that gives you the opportunity, as we said before, to volunteer people to be a part of this. Let's get as many emails so that from the Fort Wayne area, we can have 200 people that are already health equity sensitized, not just workers already, but let's make sure, as we said before, that we're finding people that, just as we're interviewing HIP and HIP eligible and people that can be impactful as we seek to provide advocacy for what we're seeking to do.
Can you hold up the small QR code?
Yep.
This is what we're looking for. We'd like for everybody here to take this survey. And if you don't want to do it by phone, I have some paper copies.
I'll take a paper.
Okay.
And can we get that to the people online as well?
Yep, we're gonna
Okay,
send it out.
okay, so like I said, we're gonna take a couple of quick comments, Lupita and then Pastor McGill, and then if anybody in the room has any additional things that they wanna say in comments or questions for the researchers, you can certainly ask. Lupita?
Okay, talking about what Alisa was saying, I have, for example, clients, Hispanic, and they have children with autism. Can be 10 years old or can be 19. They need to travel to Indianapolis or to South Bend for have right dental care because these children are special. And then they need to, I mean, these ones can make the trip, but there's many other ones that cannot make the trip. The second thing is, I think some of the people that should do this kind of meetings never make it to the meeting. I, for example, work with a navigator in duties, enrolling the people, and she was not allowed to be here.
Like her job would not permit for her.
Exactly.
Oh, okay. Because we would welcome her.
Yeah.
I know, but she was not allowed for the people on the top, and it was the same problem than the other two people previously working in the same place has as problem, and I was working pretty well with them.
So this is where those surveys come in, where the emails come in, where people who have a voice and could contribute to the conversation can do so at a different time and relate and converse with the researchers. So that's why those things are in play. Pastor McGill, you had
I didn't finish, I have one more thing to say. It's not only the language barrier for people that don't have like English like first language. Some of them don't know even how to fill a letter, where to put the stamp, where they can take it to be sent. So then normally when I was helping people in the past, they were needing to pay that $1 or those $3 fee. I was telling them, you know what, why we don't do the whole year so then you don't have to be missing dates or keep doing this. And someone can do it, but someone don't even have the $12. That's it, thank you.
Thank you.
Thank you, Lupita.
My only comment is going to be when I came to this city 27 years ago, first person I met was Pat Turner. So that's real stuff.
Yeah.
And I promise you, I think most of you know that I'm only going to have collaboration with people that are really actively trying to heal our contamination.
Okay.
Dr. Hicks and his team are part of the solution, not the problem.
Right.
You don't know them, but you know me. And so I certify that what they're trying to do is bring, again, people that Sister Sheila, Lady Diane is talking about, bring some different people to the table. As you see, they've done in their own personal conversations. But they are linked to communities and individuals that I hope can come to the follow-up and provide us again with some additional information from the grassroots level.
Nia, did you have something? Thank you, Pastor.
Yes, real fast. So I noticed on one of the slides, you talked about like the call centers, and just how there's a barrier there, which I know that personally, because I worked at FSSA for over 5 years. So a lot of times in the call centers, so there's people in there who don't even understand the lingo of the documents that we're sending out, or the correspondence that we're sending out to these people. So my question is there any way, like, are you guys maybe offering some type of training for the people that are already in there, because they're already getting paid to do this job? So what if they're trained better at doing that job, making sure that there's a protocol or a guideline that they have to follow when people call in? If I call in, I'm like, hey, I got a correspondence in the mail and it's telling me check yes for this income limit or no for this income limit, but my income really didn't change. I mean, I did just get a raise. All those questions that they have, but they call to the call center, I don't know, when you figure it out, call it in, it's due this day. So is there gonna be some type of protocol or guideline that they have to learn and follow?
So first of all, it's important to know that we're not those guys.
Right, of course, yeah, no, yeah.
But this is what we're doing. We are making we're making recommendations, and yes, because of that communication and that bureaucratic hazing, in 2019, we were able to make recommendations. We even think we were impactful in the recommendations we made. But we are guaranteeing you that we're going to be more impactful now, because this time when we make recommendations, we're going to make recommendations with relationships that we have with everybody in this room and everybody you bring back to our Zoom call the next time, so that when that work goes forward to change these laws, we're not just the 3 of us or the 4 of us with our team by ourselves, but we have a coalition from around the state that says it's not just us, but there are more people out here from every side of the tracks and every demographic and every diverse position that all believe that these health outcomes are disproportionate in particular communities, and we have to do something about it, and we can press them to do that. So that's the extension of what we're doing right now, and the help and the hope that we have in coming to you all on today.
Can we use your data in our grant writing? Because I mean, I'm thinking about some things. We do a lot of environmental justice. I actually sit on the board here with Health Vision. But are we able to use some of this data?
I think their data is not complete yet.
It's not complete yet, but we are looking to
Okay.
So I want to thank the research team, and I forget the full name of, what's the full name of the research team?
We are Team Indiana of the Interdisciplinary Research Leaders Program of the Robert Wood Johnson Foundation.
How could I forget? Yes, I want to thank you for coming, for sharing what you have so far. And again, this is a research team gathered to come together to do interviews, to go around the state, to gather information from us and from people.
For HIPAA specifically.
Yeah, for HIP. So they know what they're doing in terms of who they have called to the research project, okay? And how they are conducting the project. They're wanting to make some recommendations that will help people address the disparities that they are finding and that we're sure they will find as they continue this process. So thank you so much for listening. Thank you for engaging. It's been kind of a way for us to let loose too. And to say some of the things and frustrations that we're feeling. And yes, and to talk about the impact of what's going on. So we thank you. I thank everybody. Excuse me? I'm thanking everybody in the room. Don't y'all want my thanks and appreciation?
Absolutely.
Miss Gwen. Miss Gwen has something to say.
I'm just watching. I see you're filling out the survey, which we need the answers to. And I think I saw somebody else with their phone doing it, one other person. But we really need to hear from all of you with that QR code before you leave today.
Yeah.
If possible.
Before you leave today, fill out the survey. And do we want to do partner sharing? Anybody, any of the partners have something? I'm sorry, Dave, did you have
just a hand going up over there?
Do we have any partner sharing? If any of the partners have something that they would like to share?
Do you want to share about our healthy sanctuary we're doing? QR code.
Okay, so we're into the partner sharing portion of the meeting right now. And that is when partners share something that is going on in your organization. Pat, you have something to share.
So I'm with Tobacco Free Allen County.
Good job, Dr. Craig.
And every year, the Center for Black Health and Equity on May the 19th has an event called No Menthol Sunday. And this is a Sunday where we encourage churches and or other entities to talk about, have information about how the tobacco companies are targeting the Black community with menthol products. And so I'm coordinating that again this year. A few of you have participated in the past, and so if anybody else here has a church and an organization they'd like to be involved, let me know.
Okay, thank you, Pat. Anybody else in the room have something that you want to share? Yes.
So me and Brenda represent an organization called Christian Community Healthcare. We're up in Grable right now, but we are a primary care and urgent care facility, completely free of cost, regardless of what your insurance is, or your income status is, or your residence. We're just a team of people that love our community, that want to give health care to people that need it, that are left with limited options. I know Grable is kind of a hike. It's about a 30-minute drive from here, but Lord willing, we are in the process of starting a pop-up clinic here in Fort Wayne off of Wells Street. We're going through some barriers ourselves with some governing bodies that are kind of making it hard for us to jump into the community, but we are actively doing that. And we are in the process now of remodeling a building to build a standing clinic on Wells Street. So I know we're kind of limited on there, but if you have people in your organizations or know people that could just use a doctor, we're there in evening hours so they don't need to take off work. And we'd love to just step in and help serve these communities however we can.
Thank you so much, Austin. I see Tony has his hand up online. Tony, did you have something you wanted to say?
Yes, good morning, everyone. I'm actually in my office, so I can see the meeting on a much larger screen. Thank you so much. This was a fantastic discussion, and hats off to our researchers for this incredible opportunity. In terms of what's happening, I just wanted to share that IMHC is in the process of hiring a postdoctoral fellow. This will be our first venture into that area, and we're sort of building the airplane as we fly it, but we have interviews scheduled coming up next month, and we're really excited. And this postdoc will focus on maternal child health issues for a 2-year period.
Thank you, Tony. And IMHC is Indiana Minority Health Coalition, for those who are unfamiliar in Marion County.
And thank you to our Fort Wayne affiliate.
Thank you. We are the Fort Wayne affiliate for IMHC. Brenda.
I want to piggyback off of what Austin said. I was in the clinic for 2 hours last night. I'm going to be in the clinic tomorrow. There's a lot of times where I see, last night, 2 people. Thursday nights are my normal night. Sometimes I don't see any people. And so being able to get the word out that this is available, I know it is not the solution. We don't have the ability to get people to specialists for free. We don't have the ability to get CAT scans and MRIs and those kinds of things for free. Discounted, yes. Labs discounted, yes. So I know it's not the end-all solution, but we are there Monday mornings, Tuesday, Wednesday, and Thursday evenings for at least 2 hours, for as long as it takes to see the people who come through our doors until we can get to a point where we have to put a limit on patients. We're not limiting patients. We're there. I was there last night. I'll be there again tomorrow night. I'm a physician assistant in Fort Wayne. I want to help, but if people can't get to us, I don't know how to fix that except for coming onto Wells Street here in the next couple of months. But I just want people to know, if you know people that need us, no questions asked. We do demographics because we do need grants to be able to support what we're doing. We're not receiving government funds to do what we're doing. It's all donation based. So we're there, we're available. So for those people who can make it, we want to see you and we want to help. Okay. Second thing is, I also work for Alliance Health. Alliance Health is an FQHC in Fort Wayne on Pettit and Lafayette. I also work in the rescue mission for them. We have a health navigator there that is not limiting people to staying with Alliance. He says, his name is Michael Glover, he's our Director of Operations. He says anybody who needs a navigator, come in, he will help. And I know transportation is a barrier, and I'm seeing that in my own patients, my rescue mission patients. But he said he's there, he's available, come, he'll help you walk through these things. I don't think he can do what Lupita does, which is way above and beyond, to be able to go to houses, but he is there in the Lafayette and Pettit office building, Monday through Friday, 8 to 5, to be able to help people to get insurance as well. So I know these are not long-standing solutions to a problem bigger than that, but at least maybe it's a drop in the ocean to help to, at least for now, give people opportunities to get the help that they need.
Thank you so much. Is there anybody, you have an event that you want to talk about?
I do.
Yes, ma'am.
We have PBC Healthy Safe Sanctuary. We'll be collaborating with Health Vision. That will be on May 5th. That will be after morning worship service, or about 11:30 or so. And then we have our Roots and Resilience. This is a quarterly collaboration, once again, with Health Vision. That'll be on Sunday, May 26th, and we're looking for vendors. Thank you.
Awesome. PBC Pilgrim Baptist Church, for those who are unaware. Any more announcements online? Ann?
CTN has been working on a regional assessment in Fort Wayne and the surrounding counties for the last year. I know that transportation has come up a lot today, and it comes up a lot in a lot of conversations, and we're hoping to be able to use that survey to show how great the need is for transportation in our area. And it's not just the population that we serve, it was put out, and it's everybody. So it's not just seniors and people with disabilities. So hopefully that's going to be out in the public, hopefully next month. So if you're interested, send me an email, and I can start to make a list of some people who might be interested in it.
Thank you, Ann. Anybody else online have an event that you want to talk about real quick before we close up? All right. Anybody else?
Just the team.
Okay.
You got a few sandwiches, please, take them.
Yes.
Do we have you guys information?
Is there a link for the survey?
Yes, Tony, we'll be sending it after this call. Thank you so much.
Okay, all right, thank you.
I appreciate that. So for Health Visions, we always have our Thriving Thursdays every other Thursday, hosted by Ms. Peggy. We also, as Lupita has already shared, have our programming with her. We also will be having our annual health fair on June 22nd. So please mark your calendars. We're also looking for you guys to come alongside us and be there on that day, June 22nd.
So any vendors or partners who want to come alongside us in continuing to plan that health fair, please connect with Cassius after this meeting, by email or in person if you're in the room, so that we can get that going and let you know more about that. We welcome all of our ACHEC partners for that. And
This Friday, I have an event to talk to the Hispanic population about this. So it's gonna be around 9:15. And also I'm gonna have like a Mother's Day event on May 10. If somebody from some agency wants to make a little donation of, I don't know, about some cookies or something for the clients.
Mother's Day is a big deal.
In Mexico,
Even
yeah.
a bigger deal perhaps in Mexico than it is here. And so people take off work and things like, oh no, it's not on a Sunday.
In Mexico, it's a big.
It's on the same day every year in Mexico.
All across the world.
Everybody fill this out, fill out this survey as well. You got a lot of surveys to fill out. Fill this out. This is for our grand tour, IMHC. Tony, he left, thank goodness. But fill this out.
No, he's right there.
Oh, is he on there?
He's right
Oh, so we need y'all to fill this out for IMHC so that we can let them know that we did this. Thank you so much. We have a lot of sandwiches and juice.